I am deeply honored really today to be with all of you, the global leaders of effort to save children in every country, to save every child. When I was reading that 2 million children, I would like to add 2 million children every year. In India alone, 2 million children die every year in India alone. My father, who was a budding economist in India at that time in 1945, was released from the prison. He took part in the freedom movement. He wanted to go to the US for studying economics further, got his admission there, and before leaving, 1 week before that, he went to see Mahatma. Gandhiji was sitting in this hut. My father bowed to him, asked for his blessings. The old man looked at him for a few seconds and uttered only one sentence. He said, "If you want to study economics, go to the villages of India." My father quietly came out and tore away his fellowship papers, travel documents, and admission papers. And within 1 month, he started living in a village in the same Wardha district. In 1985, when Rani, my wife, and I came back from the US after studying public health there, Mahatma's words were still echoing in our ears. Go to the villages of India. And from here, we have the challenge of how to provide health care to these villages. Scattered communities with huge distances, no roads, often no electricity, no schools, no television, no access to hospitals. The challenge is how do we provide health care to these kind of villages. In the initial years, women complained that their children were dying. And so we established a laboratory of community health, 86 villages. And we measured for the 1 full year, we measured child mortality. Out of 1,000 born, 121 died within 1 year. But the main causes, as you all know, newborn mortality contributes the maximum. Nearly 50% of child deaths occur during first 1 month of life. So which means newborn period is nearly 59 times more dangerous or risky than rest of the childhood. And the other causes are pneumonia, diarrhea, malaria, and diseases which can be prevented by immunization. More or less similar proportions, same stories world over in developing countries, and the malnutrition contributing to almost each of these. We had to do something for this newborn baby born in villages. Mahatma Gandhi had given one talisman to people like I and you. So he said, whenever you are in doubt, bring before your eyes the most miserable, wretched and helpless human being that you ever saw. And then ask yourself that the step that I contemplate, will it reduce his misery? Will it empower him? When we ask this question to ourselves, who was the most miserable, wretched, helpless human being that we ever saw? This child. The newborns, born and cared for in rural areas, have no protectors. Not only they don't have protectors, they are not even recorded as human beings. Most of the newborn babies, even birth is not recorded. Their birth is recorded when they become 5-year-old and when they need to go to school. That is the first time government records them. They are not given name. Why? Because parents are not sure that they will survive. If the survival is not ensured, why should they waste time and money in naming the baby and then keeping a memory of a dead child? They don't name. In all traditional societies, newborns are not named. In the US, babies are named even before they are born. When women go to hospital for delivery, they have to first tell, if boy, John, if the girl, Jenny. 27 million babies are born every year, and out of this, currently 1 million newborn babies die every year in India alone. We contribute the largest number of newborn deaths as well as child deaths in the world. Out of this, 51% are born at home by home delivery. And even the hospital delivered babies within 24 hours are discharged. Not surprisingly, these babies become infected, they become cold, and they die. When they become sick, what is the access to health care? Yes, modern medicine provides us possibilities, enormous possibilities. But where are these hospitals? Gadchiroli district is 350 kilometers long. There is only one single place in the entire district where newborn care can be provided. Home-based newborn care, which will provide low-cost, home-based model of primary newborn care by using the human potential in villages, and actually rather than human potential I should be saying using the woman potential in villages. So we conceived of alternative model in 1990. When we talked about that, everybody laughed, because the World Health Organization was previous 20 years recommending one-liner: if a newborn is sick, hospitalize. Nothing less was acceptable to the global powers. If newborn is sick, hospitalize, as if hospital was waiting next door. This is a woman, her name is Kajubai. Kajubai is from a village called Ambe Shivni in Gadchiroli. A woman in her 30s, had 7 years of schooling, with social attitudes, trying to do something for her own village. One such woman from every village was selected to become the community health worker for her own village. 39 such women were selected from 39 villages. And look at now impact of this home-based newborn care on newborn mortality rate. This is NMR, newborn mortality rate. Out of 1,000 babies born, how many died? Now this red bar is the control area, government program area. To begin with, NMR was 58. From 1993 to 2003, with some random fluctuation, you will see that the NMR has essentially remained at or above 60, which means in India, we have practically done nothing for newborns for 10 years. And the NMR has remained practically at the same level. Same, the national data also is the similar. And in the intervention area, the baseline NMR was 62, and with home-based newborn care, it steeply declined. By the end of the third year, it came down to 26. 62% reduction in the NMR. Who did this miracle? These are the 4 women. Who are the 4 pillars of this miracle, if it is a miracle? Mother, grandmother, who have taken care of these babies. In this case, they are twin babies, both twin low birth weight babies. They are cared for at home by these, and this is traditional birth attendant, and this is the main new community health worker we have introduced. 4 women per village. Now look at these women more carefully. Do you find that they are very exceptional kind of women? Do you think they are PhDs or MDs? Or you think that these kind of women are there in every village in India, every village in Asia, every village in Africa?